So very good evening to everyone. This is Dr. Shubham. Welcome back to my channel, and in this particular session we are going to talk about a very important topic from surgery, that is the testicular torsion. So before we talk about the testicular torsion, let me familiarize some of the structures regarding the testis and adjacent to the testis, so that we can really understand about this particular topic, that what is this testicular torsion, right? So let's look at this particular diagram. Here we can see that this particular structure is the testis, obviously, right? And the covering of the testis, you can see over here, the epididymis is actually covering the testis from outside, right? Then after the epididymis there is a layer which is called as the tunica, okay, which is called as the tunica. Tunica is the outermost layer of the testis, right? Then what happens is, after the epididymis, you can see what is this epididymis structure. This structure which I am highlighting right now, this is the epididymis, right? Then further this structure, you will see that it is actually converting into the vas deferens, right? Into the vas deferens, this one, right? Red and blue, you can see the red one is the testicular artery. Then there will be the testicular vein also, and here they are showing the spermatic cord, right? These are the spermatic cord, right? Now if you will compare this particular image with this one, then what you will find is, you can see twisting of the spermatic cord. So due to this twisting of the spermatic cord, as you can compare these two images, the the structure of the testis will also suffer. So due to this twisting, what happens is the testis also undergoes the torsion, and you can see this is the normal lying testis, but here you can see the testis is actually has undergone the torsion over here. So let's just talk about this particular torsion of the testis and what are the important aspects of this particular testicular torsion, right? So what is the testicular torsion? If somebody is asking us, then our answer will be very simple, that twisting of the spermatic cord that results in the compromised blood flow and ischemia of the testis, right? So basically what is this? This is basically simply twisting of the spermatic cord is causing this. Now as the twisting of the spermatic cord happens, right, it results in compromised blood flow to the testis, obviously, right? We saw that there was a testicular artery also, so the blood flow will be compromised blood flow to the testis, actually compromised blood flow to the testis, and due to that, right, compromised blood flow to the testis, and due to that ischemia will be seen, right? Ischemia will be persisting, or ischemia persists, right? So that is a simple definition of this particular testicular torsion. Now this is actually a surgical emergency, right? Be very clear, this is actually the surgical emergency. Here the person needs to go to the surgeon, and they will actually explore the testis and will do the surgical exploration of the testis over there and the scrotum, right? So this is the surgical emergency basically, right? Okay, I will talk about that. So this is the case of testicular torsion. Now it is seen commonly, so it is commonly seen in the neonates, and the adolescent age groups, right? Now risk factors, what are the risk factors? Basically those persons who are having history of testicular torsion, for example, they are much prone for getting this, or any recent trauma to the testis, right? Right, something which hit the testis during the fight or something like that. Okay, so recent trauma to the testis, or prior history, that is also important. If there is prior history of testicular torsion, basically, right, prior history of testicular torsion, okay, prior history of testicular torsion. Now let's talk about the pathogenesis of this particular testicular torsion, okay? Pathogenesis. If we talk about the pathogenesis, basically It is very simple to understand. Actually, before the birth, the testis actually moves from the through the inguinal canal and it moves into the scrotum, right? So there is a decent pathway. Sometimes what happens is this pathway is getting affected, right? What I'm talking about, this is called as a processus vaginalis. Processus vaginalis. Okay, so this is the path through which the testis actually leaves the abdomen, okay, and will be coming into the appropriate location, right? So this is the path where the testis leaves the abdomen with the peritoneal lining. Now if it is getting twisted, then obviously it will be causing the deceleration of the blood flow, and the testicular torsion might happen, right? So the blood flow will be actually twist, and blood flow will be actually decelerating, and due to that ischemia will be seen. So ischemia of testis will be seen. Due to that, ischemia of the testis will be seen actually. Okay, now basically what will be the signs and symptoms? If we talk about symptoms of such patients, now symptoms will be very, very clear. The primary symptom, if you talk about the adolescent, right, there are two cases over here. Either it can be seen in the neonates, either it can be seen in the adults. If we talk about the adults, in the adolescents, basically there would be the severe pain unilaterally, right? In the unilateral scrotum there will be the acute onset and the severe pain will be seen over there. So acute onset and severe pain will be seen. Acute onset severe pain in unilateral scrotum, in unilateral scrotum, right? So unilaterally it is seen basically. And if you talk about in the neonates, then blue unilateral scrotal mass will be seen, right? Like which you can see in this particular image, right? Here you can see this is the bluish color mass. You can see over here, this is actually testis which undergoes torsion due to the twisting of the spermatic cord, and then it actually cause this particular testicular torsion, right, due to the twisting of the spermatic cord. This will be seen in the neonates. In the adolescents, these adolescents will be coming up with the acute pain on the unilateral side of the testis, right? Then there are some signs which are seen in this particular testicular torsion. Okay, what are these particular signs? Let me just talk about them as well. So if you talk about some signs which I'm talking about over here, okay, let me just talk about those signs as well. For example, first sign which you can see in these patient, that will be the Deming sign, right? That will be the Deming sign. Now what is this Deming sign? Basically in this Deming sign, the testis which has undergone the torsion actually will be lying at the higher level, right? So the affected testis which has undergone torsion, affected testis will be lying at higher location or higher level, lying at higher level, okay, lying at higher level. There is one more sign which can be seen in these particular cases, which is the Angel sign, right? Now what do I mean by the Angel sign over here in this testicular torsion? Now here the testis which has undergone the torsion will be actually transversely or the horizontally placed, right? So affected testis will be transversely placed, right? Will be transversely placed. Clear? Then one more sign is there, that is the Praying sign. But this sign, actually what is this sign? Basically here, if the patient comes, right, if you will try to lift the affected testis, the pain will be increasing if this is the case of testicular torsion, right? And if the pain is increasing by lifting that affected testis, this Praying sign will be negative. Actually by doing this you are eliciting the Praying sign. If the patient is getting relieved by lifting up the testis, then this Praying sign will be positive. So this Praying sign will be seen as negative. A Praying sign will be negative in torsion cases. In testicular torsion, the Praying sign will be negative. What is Praying sign? Lift the testis. What is Praying sign? Basically in the praying sign, you are actually doing nothing but lifting the affected testis, lifting the affected testis and checking the response of the patient. If the patient pain is actually increasing, then it is the torsion, right? If the patient pain is decreasing, this is the positive praying sign which is seen in the epididymoorchitis. So praying sign is differentiating between the torsion and the epididymoorchitis. So which means epididymoorchitis, which is the inflammation of epididymis and the testis, right? So if you are eliciting the praying sign, you can actually differentiate between the testicular torsion and the epididymoorchitis by eliciting this praying sign. If the praying sign is positive, then it would be the epididymoorchitis. If the praying sign is negative, then this would be the testicular torsion. What is praying sign again? You will be lifting up the testicular torsion side, I mean the affected testis, you will be lifting it up. If the patient pain is increasing, then this is the negative praying sign, which is the testicular torsion case. If the patient pain is decreasing, right, then this means this is the positive praying sign. It will be seen in the epididymoorchitis, right? If you will be having any confusion, please write in the comment box below, or you can just listen this part again. Now we have talked about three signs: Deming sign, angel sign, and the negative praying sign will be seen over here. If you will be examining this particular patient, then you will be seeing that patient will be having the testis, affected testis will be having the transversely placed or the horizontally placed, right? This I have talked about. Along with that, you might see some of the erythema over there, redness or some swelling might be seen as well. One more thing, Cremasteric sign will be absent over here. Okay, so I am just mentioning over here that there will be the negative sign of or absent Cremasteric reflex. Absent Cremasteric reflex. Okay. Now, what is this absent Cremasteric reflex? So, what is this Cremasteric reflex? By the way, this Cremasteric reflex is shown over here. Okay. Now, look over here. Yeah. So, what I am doing is I am just stroking this, inner side of the thigh. By stroking the inner side of the thigh, just touching the inner side of the thigh in this manner. Okay. If I am doing this, and simultaneously, if the affected testis is also going upwards, right, then this is the positive Cremasteric reflex, right? But this Cremasteric reflex is negative in the testicular torsion cases, right? Actually, what happens is by stroking on the inner side of the thigh, by touching in this manner, right, the Cremasteric reflex gets contracted, and due to that, testis will be going in the upward direction. Okay, that is the positive Cremasteric reflex. But this sign will be seen negative in the testicular torsion, right? Sometimes the question they just mention that positive Cremasteric sign or negative Cremasteric sign. If they are writing the positive Cremasteric sign, it means they are not talking about the testicular torsion, right? If they are saying negative Cremasteric reflex, then obviously this could be the testicular torsion, right? So that was just a brief explanation about the Cremasteric reflex, right? Now, how you can just take some help of investigation. So as far as investigations are concerned, then you can definitely take the help of Doppler ultrasound. Yeah, that could be very beneficial in some cases. So investigation would be the Doppler USG, right? But always remember, Doppler USG or Doppler ultrasound is supportive for our case. It is not mandatory for every person. If some person is having the emergency, then surgical exploration directly should be done. We should not wait for the Doppler ultrasound, right? If you have time, the patient is not that serious, the patient is not talking about that much serious pain, then obviously you might take the help of Doppler ultrasound. Doppler ultrasound, we are not taking the help of Doppler ultrasound for confirming our diagnosis. We are just taking the help of the Doppler ultrasound for supporting our diagnosis, right? So that is the case. Now, if we talk about diagnosis, that will be actually confirmed by the surgery only, but supportive, yes, that is Doppler ultrasound. Now, if you talk about the Cremasteric reflex, that will be negative in the testicular torsion, but if it is positive, that will be seen in the epididymitis. It means epididymitis is a important differential diagnosis in such cases, right? So what about the treatment, guys? Now, what about the treatment? Treatment would be, yeah. So how about the treatment over here? So treatment is having the two parts over here. Now, one part is that you might do the orchiopexy, okay? you might do the orchiopexy or orchidopexy, okay, or you might do the orchiectomy or orchidoectomy, okay, orchiectomy or orchidoectomy. Okay, in what case you will be doing the orchidectomy? It is very simple. If you were surgically exploring the testis and it was already necrotized, for an example, or if the testis is not viable actually, then obviously you will be going for the orchiectomy, right? So if the testes are not viable or testes are already necrotized, right, testis is not viable or testis already necrotized, then obviously you need to just remove the testis. But if the testis are viable, right, the testes are there, they are viable, then we need to do the derotation of the testis, because testicular torsion we are talking about, right? Testis has undergone torsion due to the twisting of spermatic cord, so we can manually derotate, right? Surgeon will try to manually derotate if the surgery option is not available, or if the surgeon will be feeling to do it, then they will be actually derotating, they will try to derotate the testis over there. And the prognosis depends on the time. Basically the time is very crucial in these cases. For an example, if the surgical exploration we did it before 6 hours, then prognoses are very much favorable, right? We can save the complete testis over here. But let's say if the patient couldn't reach to us in the time, or we took some more time to diagnose this case, then obviously, and this diagnosis is the surgical emergency, I already told you, and this completely depends on the clinical skills of any clinician or surgeon, right? So actually if there is some delay in this particular making the diagnosis, then, or if the surgical option is not available in any particular center, then obviously the person might lose the testes as well, right? We might do the orchiectomy in this case. So orchiopexy will be done in those cases where the patient reached to us in time, right? So before 6 hours, 100% salvage rate is there, which means the complete testis we can save over there, right? That is the case. Otherwise, if the patient surgery is done after 12 hours, let's say, then only 50% chances are there. So for an example, 90 to 100% salvage rate is there, 90 to 100% salvage rate is there if, okay, salvage rate, which means we can save the testis if the person reach in time. I mean, I'm talking about the 6 hours. I mean, if the person reached us or exploration happens in 6 hours, and about 50% salvage rate is there if the person reaches to us in about 12 hours, after 12 hours or within 12 hours, right? And even less than 10% rate is there, less than 10% salvage rate is there if the person will be coming for the surgery, for example, after 24 hours or within 24 hours, let's say. Okay, after 48 hours or so, testis will probably will be necrotized due to the affected blood supply, due to the ischemia, and orchiectomy needs to be done in those cases, right? Complications might be, obviously testicular ischemia might be there, time is very crucial, infertility might be there in the coming time, right? I told you about the prognosis already. If the patient comes in time, prognosis is very good. If the patient couldn't reach in time, then obviously the prognosis are not that good as far as this affected testis is concerned, right? So this was about the particular testicular torsion, just a brief info explanation about testicular torsion. I hope you enjoyed this session. Let me just try on some MCQs so that we can understand how to apply this particular knowledge in the questions. So let's just take this particular MCQ. A 15-year-old boy, as I said that adolescents are very much affected over here, or the neonates, presents to the emergency room with the severe lower pain abdomen over here, and that awoke him from sleep about 3 hours ago. The pain is sharp and it is radiating also towards the left thigh. While in the emergency room, the patient is experiencing one episode of vomiting, and temperature is about 99.3 degree Fahrenheit, and BP is 126/80, and pulse is 119 because of fever probably, and the pulse rate is high. Respiration 14, oxygen saturation is fine, 99. Now abdominal examination reveals that there was no tenderness in all 4 quadrants, so there is no abdominal problem as such. Scrotal examination was done and it revealed there was elevated left testicle that is diffusely tender, and stroking of the patient inner thigh on the left side does not result in the elevation of the testicle, which means they're talking about which sign? They're talking about the cremasteric reflex over here. They're talking about the cremasteric reflex over here. And I told you that cremasteric reflex will be absent in the testicular torsion, but it was present in the epididymis inflammation, right? So cremasteric reflex will be negative, and here they are talking about stroking of the patient inner thigh on the left side does not result. It means they are talking about negative cremasteric reflex. Negative cremasteric reflex, as I told you, it will be seen in the testicular torsion. So they're just asking you what the next step in the management of this patient. So it would be what? This is the case of acute pain and adolescent they are talking about. So this is the testicular torsion, and this is a surgical emergency. I already mentioned about that. So this is the surgical emergency. So some of you might be thinking about the Doppler USG, doing the Doppler USG over there, which is the E option, last option, testicular Doppler ultrasound. But I told you that if there is an emergency, we should not wait for the testicular Doppler ultrasound, because time is very crucial in the testicular torsion. So if we want to salvage 100% testis over there, so time is very crucial. Here the person was having so much of pain that it just awoke him from sleep. So basically we need to explore the testis over here. So surgical exploration will be the better option for us to do that. So surgical emergency will be the appropriate answer to this particular question. Let's say if the surgical exploration was not in the option, then you might go with the Doppler ultrasound, but here surgical exploration will be the better choice for us. Okay, moving on to the next question over here. 16-year-old man presents to the emergency department with a 2-hour history of sudden onset abdominal pain, and this person, he was again 16-year-old man. So sudden onset abdominal pain they are talking about. Now he was playing football when his symptoms started. Now patient past medical history is notable only for asthma, and social history is notable for unprotected sex with 4 women in the past month. So he's having that history. His temperature is 99.3 and BP is fine, and pulse is on the higher side, right? Now respiration is fine and oxygen saturation is also fine, there is a 99%. Physical exam is noted for non-tender abdomen. Testis exam reveals that it reveals a right testicle which is elevated with a horizontal lie, right? And the scrotum is neither swollen nor discolored, right? So they are talking about right testicle which is elevated with a horizontal lie. I again told you in the beginning of this particular session that the transversely placed or the horizontally placed testis we are talking about in the testicular torsion, and the name of that particular sign was the angel sign. So here they are talking about the angel sign, right? So here they are talking about the angel sign, right? Angel sign. So that is the thing over here. And I told you that angel sign will be seen in the testicular torsion. So what is the most likely diagnosis over here? Yes, it is very simple. That is the testicular torsion, right? So I hope you understood the idea of the testicular torsion. If you have enjoyed this video, please share it with your friends. Please subscribe the channel, and I will see you in the next one. Thank you so much for joining this one. Bye bye, take care.